I have heard a lot of people talk about seed cycling, and today I want to tell you the 5 most important things about what it is and what it is not, with number 3 being the most important. Hi, my name is Dr. Basma Faris, and I am a board-certified OBGYN with an expertise in PMOS and nutrition. The first of the 5 things to know are, what is seed cycling? Seed cycling is a wellness practice, not a medical one, that suggests eating certain seeds during different parts of your cycle to balance hormones. In the first half of the cycle, called the follicular phase, people are told to eat different types of seeds. And then in the second half, called the luteal phase, the recommendation switches to a different set of seeds. The idea is that these seeds can support estrogen in the first half and progesterone in the second half. However, this concept comes from naturopathic and wellness communities, not from established medical guidelines or clinical research. The second of 5 things to know is what seeds are used in seed cycling and why these seeds were chosen. The most commonly used seeds in seed cycling are flax, pumpkin, sesame, and sunflower seeds. The typical protocol is very specific. During days 1 through 14 of your cycle, or from your period until you ovulate, you are supposed to consume 1 to 2 tablespoons of ground flaxseed and pumpkin seeds every day. Then during days 15 through 28, or from ovulation to your next period, you switch to sesame seeds and sunflower seeds. Each of these seeds contain nutrients like fiber, lignans, and healthy fats, which are beneficial for general health. Flaxseed in particular has been studied the most and contains compounds called lignans that can interact with estrogen pathways in the body. However, the key point is that these seeds are usually studied on their own, not as part of a cycling protocol. Number 3, and probably the most important, there is no clinical evidence that seed cycling actually works the way it claims to. There are no randomized controlled trials showing that seed cycling regulates hormones, improves fertility, or reduces PMS. While some individual seeds have limited data suggesting mild hormonal effects, these studies do not support the idea that rotating seeds by cycle phase meaningfully changes hormone levels. For example, flaxseed has been shown in small studies to slightly influence estrogen metabolism and possibly lengthen the luteal phase. But this was with continuous intake, not cyclic intake. Other seeds like pumpkin and sunflower have little to no clinical data in women. So while the theory sounds appealing, the science simply is not there. Number 4 is that seed cycling is generally safe. So if you want to try it, you can. It's not going to cause harm, but it should not replace real medical care or evidence-based treatment. If you enjoy these seeds, there is no problem incorporating them into your diet. They are nutritious, high in fiber, and contain healthy fats. For most people, seed cycling is not harmful. The concern is when it is positioned as a solution for real medical issues like irregular periods, infertility, or real hormonal imbalances. These conditions often require proper diagnosis and treatment. Relying on seed cycling instead of seeing a physician can delay care and potentially worsen the underlying disease. As a board-certified OBGYN, I would emphasize lifestyle changes can support health, but they should never replace evidence-based medical evaluation and treatment. Finally, the real takeaway is that these seeds are healthy, but the cycling part is not what drives any benefit. If there is any benefit here, it likely comes from the seeds themselves, not the timing. Flaxseed, sesame seeds, and others provide fiber, omega-3 fatty acids, plant compounds, other minerals that may support overall metabolic and cardiovascular health. But there is absolutely no physiologic evidence that your body responds differently to these seeds based on the day of your menstrual cycle. Hormonal regulation is controlled by complex signaling between the brain, the ovaries, and the rest of the endocrine system, not by switching seeds every 2 weeks. So if you want to include these foods in your diet, please do so for their nutritional value, not because you expect them to rebalance your hormones. The bottom line is simple. Seed cycling is not harmful, but it is not a substitute for real medical management. It is a trend built on theory, but not evidence, and should never replace actual medical care that is backed by science. What questions do you have? Drop them in the comments below, and I will do my best to do a future video on it to answer them.